Good evening, viewers. My name is Dr. NYIRENDA. I am a specialist registrar in obstetrics and gynecology. I would like to welcome you to our first episode of COVID with ADRA. I would like to begin by reiterating that COVID-19 is real. Therefore, we need to adhere to all the guidelines provided by the World Health Organization and the Ministry of Health. And these guidelines include hand washing or using hand sanitizer, wearing a face mask when we go into public space, keeping a physical distance of 1 to 2 meters, and staying at home when we have to stay at home. In today's episode of COVID with ADRA, I will talk about antenatal care. Antenatal care is defined as the care that is provided to a pregnant woman by a skilled health practitioner. The aim of antenatal care is to ensure the best outcome for the mother and her baby. That is, the mother should be in optimum condition of health during pregnancy, labor and childbirth, and even in the aftermath, and that she should have a healthy baby. With the advent of COVID-19 pandemic, there have been a few changes in the way that we do antenatal care. And these changes have been put in place to reduce exposure of pregnant women to COVID-19. So pregnant women with uncomplicated pregnancies are having fewer than 8 visits. And during these visits, comprehensive antenatal care is done to ensure that all the problems are captured and that appropriate interventions are instituted. For women with history of complicated pregnancies and those with complications in the current pregnancies, their number of visits have remained essentially the same. And when we talk about complications in pregnancy, we're basically talking about diabetes in pregnancy, high blood pressure in pregnancy, heart disease in pregnancy, sickle cell disease in pregnancy, among others. Therefore, in this episode of COVID with ADRA, we are encouraging pregnant women to book for antenatal care and to continue attending antenatal clinic. Particular emphasis is on antenatal booking visit. We urge that pregnant women book within the first 3 months of knowing that they are pregnant. This is a very important visit where a comprehensive history is taken and comprehensive investigations are done. These investigations include full blood count, where we get to know the level of hemoglobin. We do an HIV test, we screen for hepatitis, syphilis, and we also do a blood group, among other things. All these things are done to ensure that a pregnant woman has a memorable experience of pregnancy and childbirth. As we conclude this segment, I would like to re-emphasize that as you come for antenatal care, you keep a physical distance of 1 to 2 meters and you wash your hands or use hand sanitizer. In next week's episode of COVID with ADRA, we're going to look at screening and isolation and labor and delivery. May God bless us all and see you next time.